Hey everyone, my name is Dr. Galatia Strong. I'm a physical therapist who got 100% on my NPTE, and this led me to co-found SPT with me, which is an NPTE prep course. If you end up enjoying this video and feel like it was beneficial and are looking for more NPTE related material in particular, please check out our courses at sptwithme.com, designed to guide you towards acing your test. Now, onto what you're actually here for. Let's talk about blood pressure. First off, what is blood pressure? Blood pressure is the amount of pressure that is exerted onto arterial walls. Note that I'm emphasizing arteries, not veins. When you're taking blood pressure at the arm, it's the brachial artery. Why does it matter? Well, blood pressure provides information on how well the heart is functioning and how well blood, thus oxygen, is being distributed throughout the body. If it's too high versus too low, is there enough diffusion of nutrients going? Is there enough diffusion of oxygen circulating throughout the body? Well, we should all know that high blood pressure and having low blood pressure are not good. But what is the problem with it? Let's start off with talking about high blood pressure. High blood pressure means there is high pressure, right? AKA high force being placed on the wall of the artery. The more force there is of blood pushing into a wall that is not metal, it's soft, the more potential there is for damage to the wall. So what happens with a damaged arterial wall is that it can start to bulge, aka an aneurysm, or it can lead to a tear or a rupture, which is what happens during a stroke. With low blood pressure, blood has oxygen, right? If the blood pressure is too low, not enough blood, thus oxygen, can get to our organs. Our organs require oxygen to thrive, right? Now without that blood flow, without oxygen, because it's just too low to spread around the body, our tissues are going to die. Now as a result, we get damage to our organs. And this is exactly what happens with shock. All of the organs of the body are not getting enough oxygen. Thus, they get damaged and they malfunction. Really, every single person should have this chart known like the back of their hand, honestly. Unfortunately, this is just one of those things you might have to make flashcards with, or when you're actually practicing, you just have it on the back of your badge or something like that, on a necklace. But when you are starting to learn this chart, really pay attention to the words and the and/or. Now, oftentimes when people think about the systolic value, they usually think that's a more important one. But truly, the diastolic value is just as important. You don't want one being way too high or one that's way too low, right? Because either way, if one is not at the optimal level, that's probably going to damage the person. Now, according to the CDC, more than half of adults actually present with hypertension stage 1. So many of the patients that you meet will be in this range, but just because it's common does not mean that it's okay. So be sure to advise your patients that, not only to live a healthy lifestyle, but to really check with their doctors regarding their blood pressure if they aren't already. Contraindications to exercise with respect to blood pressure. As we discussed before, having too high of a blood pressure is no good, right? You're risking things like aneurysms, strokes. So if your patient's systolic pressure is over 240, you do not exercise them. The last slide suggests that someone who's in a hypertensive crisis is at 180. This is a whole 60 millimeters of mercury more. If your patient is exercising, you're going to expect normally that their blood pressure is going to increase along with exercise, right? In order to compensate for that increased amount of oxygen that they need to supply their muscle tissues. If you are checking blood pressure and you see that while they're exercising, that their blood pressure is decreasing, which is the opposite of what you would expect, then this is a sign that you should probably stop. Your body is not going to get enough oxygen to the tissues, and this could then damage them. Diastolic pressure. This value should not normally change much, or if anything, regardless of exercise. This is because the arteries vasodilate, and this helps maintain the pressure or even helps decrease it a tiny bit. So if the diastolic pressure increases, this is actually suggestive of an inappropriate response to exercise, and you should definitely cease exercising. As you know, SPT with me is an NPTE prep course platform. So if you're interested in watching lectures that pertain to materials specifically for the NPTE, check out our courses at sptwithme.com. Now, if you're looking to get some more practice question experience outside of the PET, take a look at typicalpt.com. I review their question bank myself. There's a ton of questions. They have some really cool analytics that give you that they give you at the very end of your practice exam that does the work for you in identifying what topics you need more help with potentially. I think SBT with me and Typical PT really complement each other. I mean, when you're studying for the NPTE, realistically, what do you need? Number one, you need to take practice questions. And honestly, are you going to take more than just 1 or 2 PET exams? Probably, right? And that's where Typical PT comes in. You're going to take some test questions. They help you identify what sections you're not excelling in. Now on to what you need next. You're going to need something to help you review what you're not excelling in. And that's where SBT with me comes in. So I'm here to help you review material and enhance your critical thinking skills. All right. So aside from taking practice tests and reviewing material for the purpose of passing those practice tests, honestly, what else do you need? So both SPT with me, Typical PT, were made to complement each other. So check it out. As always, I hope this helped. Blood pressure is a big topic. You know, everyone has blood pressure. So it's just a matter of, putting it all together and understanding why it matters and what certain things do matter with each particular patient. Lastly, here's the reference of that beautiful chart that we all must know.